Hi everyone, I'm Shani Jyotis, Associate Professor, Manoj Jain Memorial College of Nursing. Today we are going to talk about World Breastfeeding Week. Every year we are celebrating this World Breastfeeding Week. That is, every year from August 1 to August 7 is considered as World Breastfeeding Week. In 1991, a global campaign was formed. What is the name of that campaign means? WABA. What is the full form of WABA? The World Alliance for Breastfeeding Action. Okay? And this is mainly to promote, protect and support breastfeeding. And in 1992, the first World Breastfeeding Week was celebrated. Okay, and what is the main aim of this World Breastfeeding Week means to promote, protect and encourage breastfeeding. We all know that breastfeeding, it's a natural process. So through this natural process, many benefits are there. That is, there are many benefits for the baby, benefits for the mother and also benefits for the community. As we all know that breast milk is a natural source of all nutrients for the baby and it is freely available, and breast milk provides all nutrition to the baby and it provides immunity to the baby. So there are a lot of benefits for the baby and for the mother. According to WHO, every infant should breastfeed up to 6 months of their life. That is, every child, they should get exclusive breastfeeding. उनका जो 6 months life तक they should get exclusive breastfeeding. What is exclusive breastfeeding means? Only we have to provide breastfeeding or breast milk during the 6 months of life. That is, during this 6 months period, we should not give any other additional foods. Even water also we should not give to the baby during this 6 months of life. That is known as exclusive breastfeeding. Okay. That is first point which has given by World Health Organization. And the second point is initiation of breastfeeding. That is when we have to start breastfeeding. That is immediately after delivery, that is within hours, that is within 1 hour or within half an hour. In case of normal delivery, we should start breastfeeding. Okay, within half an hour or within 1 hour. In case of cesarean section, it is not possible. Okay, because after surgery the woman or the mother may have complications or may have anesthetic effect and all. So we should wait for 4 hours or until her condition stabilizes. Okay, that is second point. First point is exclusive breastfeeding up to 6 months. एंड उसके बाद हम लोगों को ब्रेस्ट फीडिंग कंटिन्यू कर सकते हैं अप टू 2 years और 3 years, लेकिन वहाँ पे हम लोगों को क्या है 6 months के बाद एडिशनल फूड दे सकते हैं और देना है. Okay, and second point is what it is when we have to start breastfeeding. And third point is that is we should not use any bottles or pacifiers, that type of things we should not use for 6 months of life. The fourth point is breastfeeding on demand. That is when the baby cries, so baby is unable to ask, right? So baby, how the baby will be asking for food? They will be crying, right? So when the baby cries or when the baby is according to baby's demand, we have to give breastfeeding. These are the main 4 points which are given by World Health Organization. So as we all know that breastfeeding is a natural process but it is a learned behavior. And for this particular process, that is for establishing breastfeeding or for maintaining that breastfeeding, the mother, she should get adequate support from family members. So for promoting that support and for promoting this breastfeeding and all, so as nurses, we should give support to the family members or education to the family members and to the mother. So we should explain the importance or benefits of breastfeeding to the mothers. This year, the theme for Breastfeeding Week is Protect Breastfeeding, a Shared Responsibility.
Hello students, we are here to celebrate the World Breastfeeding Week, which is celebrated in the first week of the August month. Okay, it is celebrated across the world, and the motive and the aim of the celebrating the World Breastfeeding Week is to educate and spread the information to the mothers and their concerning family regarding the importance of the breastfeeding, because breastfeeding is a process of feeding the milk to their children, and it helps to uh, uh, fight against many communicable and non-communicable diseases, and it also provide a long life immunity for the children to fight the various communicable and non-communicable diseases. So this is it's a 2021, and there is also a new theme which is protecting breastfeeding, and it is a shared responsibility for the everyone. So this is the title of this year to celebrate the breastfeeding week. A meaning of the title is that to spread and to educate the women regarding the breastfeeding. It is a shared responsibility. It is a responsibility for all and every person to spread the information regarding the breastfeeding to the mothers. And this is also a shareable information, because we should all share this information to everyone. Okay, so this is the meaning of the this year themes. The one of the greatest international agency, which is WABA, which means World Alliance for Breastfeeding Action. It is an international agency which take over all the actions regarding the breastfeeding across the world, and it is also a global action and global links between all over the countries to provide basic information, required information, facilities, and all the information regarding the breastfeeding to basic those countries who are very poor and undeveloped countries, where there is no any knowledge, and there is no any requirement facilities for proper educating system regarding the breastfeeding. So WABA is a basic international agency which provide the basic information and requirements for breastfeeding to all across the world, mostly those countries who they are very poor. Okay, and now discuss about the objectives of the themes is to encourage the women for breastfeeding, to spread the information of the breastfeeding and their importance of the breastfeeding, to educate regarding the communicable and non-communicable diseases, and by breastfeeding we can reduce the chance of the communicable diseases, and to encourage the practice of the breastfeeding in the mothers regarding and educate the KMC. So these are the some objectives of these themes. I hope you all have understood regarding the themes of the breastfeeding. Okay, thank you.
हेलो एवरीवन, दिस इज़ गुलाम अहमद रजा। सभी को पता है कि फर्स्ट वीक अगस्त में क्या सेलिब्रेट करते हैं, ब्रेस्ट फीडिंग वीक्स। ओके, तो जो 1 अगस्त से 7 अगस्त तक होता है उसमें हम क्या करते हैं, ब्रेस्ट फीडिंग वीक सेलिब्रेट करते हैं। तो मैं आप लोगों के सामने क्या करूँगा, आप लोगों का इम्पोर्टेंस ऑफ ब्रेस्ट फीडिंग के बारे में बताऊँगा। तो हम देखेंगे इम्पोर्टेंस ऑफ ब्रेस्ट फीडिंग के बारे में। तो जो ब्रेस्ट फीडिंग है वो क्यों इम्पोर्टेंस है, क्यों दिया जाता है ब्रेस्ट फीडिंग, अगर ब्रेस्ट फीडिंग नहीं देंगे तो क्या होगा, तो हम इसके बारे में जानेंगे। तो जो ब्रेस्ट फीडिंग क्या होता है, ब्रेस्ट फीडिंग इज़ आल्सो नोन एज नर्सिंग। ब्रेस्ट फीडिंग है उसको नर्सिंग के नाम से भी जाना जाता है, और ये क्या होता है, एक बेस्ट वे होता है जो कि यंग इन्फेंट को क्या करता है, उसके ग्रोथ एंड डेवलपमेंट के लिए जो भी इसेंशियल न्यूट्रिएंट्स होते हैं उसको रिक्वायर्ड होते हैं, उसको क्या करता है, ब्रेस्ट फीडिंग प्रोवाइड करता है। और जो WHO है, मतलब वर्ल्ड हेल्थ ऑर्गेनाइजेशन, उन्होंने क्या कहा कि जो ब्रेस्ट मिल्क होता है वो यंग इन्फेंट के लिए क्या होता है, एक आइडियल फूड होता है। और जो ब्रेस्ट मिल्क है वो सेफ़ है, क्लीन होता है, और वो क्या होता है, बेबीज़ के लिए फर्स्ट वैक्सीन के रूप में वो कार्य करता है। और वो क्या करता है, जो ब्रेस्ट मिल्क होता है वो क्या करता है कि चिल्ड्रंस को क्या करता है, जो भी उसके लिए कॉमन चाइल्डहुड इलनेसेस होती हैं उससे क्या करता है, उसके अगेंस्ट उसको प्रोटेक्ट करते हैं। अगर ब्रेस्ट फीडिंग क्या करते हैं चिल्ड्रंस को यानी इन्फेंट को कंटिन्यूसली अप टू 6 मंथ तक एक्सक्लूसिव ब्रेस्ट फीडिंग प्रोवाइड करते हैं, तो उसके कारण चिल्ड्रंस को जो भी कॉमन चाइल्डहुड इलनेसेस होती हैं उससे ब्रेस्ट मिल्क क्या करता है, प्रोटेक्ट करता है। WHO ने क्या किया कि रिकमेंड्स किया कि जो ब्रेस्ट मिल्क होता है तो आफ्टर चाइल्ड बर्थ, जैसे मदर्स है अगर उसकी डिलीवरी हो जाती है तो उसके बाद क्या है, अगर नॉर्मल डिलीवरी होती है तो उसके बाद क्या है, विद इन फर्स्ट आवर ऑफ चाइल्ड बर्थ के अंदर ही उसको क्या है, ब्रेस्ट फीडिंग स्टार्ट कर देना चाहिए। ठीक है। और WHO ने ये भी कहा कि जो एक्सक्लूसिव ब्रेस्ट फीडिंग है वो क्या है, अप टू 6 मंथ तक कंटिन्यू करना है। इट मीन्स एक्सक्लूसिव ब्रेस्ट फीडिंग मीन्स क्या होता है कि जो चिल्ड्रंस होता है उसको क्या करते हैं 6 मंथ तक क्या करते हैं, ओनली ब्रेस्ट फीडिंग ही प्रोवाइड करते हैं और अदर देन कुछ भी फूड वगैरह या एक्स्ट्रा न्यूट्रिएंट्स प्रोवाइड नहीं करते, क्योंकि जो ब्रेस्ट फीडिंग होता है, ब्रेस्ट मिल्क होता है, उसमें सारे न्यूट्रिएंट्स पाए जाते हैं जो कि क्या करते हैं, चिल्ड्रंस के लिए एसेंशियल होते हैं, रिक्वायर्ड होते हैं। वो सारी चीज़ें क्या होते हैं, ब्रेस्ट मिल्क में सारी चीज़ें इंक्लूड होती हैं। नेक्स्ट क्या है, जो ब्रेस्ट मिल्क होता है उसमें क्या है, बहुत सारे बेसिक इसेंशियल न्यूट्रिएंट्स इंक्लूड होते हैं चाइल्ड हेल्थ के लिए, जैसे कार्बोहाइड्रेट हो गया, प्रोटीन हो गया, फैट्स हो गया, एंड आल्सो वाटर भी उसमें इंक्लूड रहता है, जो कि काय के लिए होता है, वाटर हाइड्रेशन के लिए। ठीक है ना। तो अदर न्यूट्रिशनल वैल्यूज़ आर इम्यूनो बूस्टिंग वाइट ब्लड सेल्स फॉर डेवलपमेंट एंड हीलिंग्स। इसमें क्या है, अदर इम्यूनो बूस्टिंग WBC भी पाए जाते हैं जो चिल्ड्रंस के डेवलपमेंट और अगर कुछ भी प्रॉब्लम होती है तो उसको हील करने के लिए भी क्या होता है, ये हेल्प करता है। WHO और यूनिसेफ ने बताया कि जो ब्रेस्ट फीड चिल्ड्रंस होते हैं वो क्या करते हैं, वो उनका इंटेलिजेंट टेस्ट अगर होता है तो बेटर परफॉर्म करते हैं। ठीक है ना। आर लेस लाइकली टू बी ओवरवेट। और क्या होता है, अगर ऐसे चिल्ड्रन जो कि ब्रेस्ट फीड करते हैं तो उसमें ज़्यादा वेट उनका, मतलब ज़्यादा वेट कहने का इन द सेंस मतलब ओबेस जो चिल्ड्रंस होते हैं ना, ओबेसिटी मतलब मोटापा होता है, तो अगर ब्रेस्ट फीडिंग कंटिन्यू करते हैं तो उसमें मोटापा देखने को नहीं मिलता है और उसमें लेटर लाइफ में उनको डायबिटीज़ होने का ज़्यादा खतरा नहीं होता, मतलब रिस्क नहीं होता है। नॉट जस्ट बेबीज़, ब्रेस्ट फीडिंग इज़ आल्सो बेनिफिशियल फॉर वुमेन। जो ब्रेस्ट फीडिंग होता है तो वो चिल्ड्रंस के लिए बस हेल्पफुल नहीं होता, मतलब बेनिफिशियल नहीं होता, ये आल्सो क्या होता है, जो मदर्स होती है उसके लिए भी बेनिफिशियल होता है। और WHO ने ये कहा कि जो वोमेन होती हैं अगर वो कंटिन्यूसली क्या करती है, अपने चिल्ड्रंस को ब्रेस्ट फीड कराती हैं तो वो क्या होता है, उनमें होने वाले जो ब्रेस्ट और ओवेरियन कैंसर होते हैं तो उसके रिस्क से भी उनको मतलब उसके रिस्क को भी रिड्यूस करता है ब्रेस्ट फीडिंग। और इसमें क्या होता है, जो ब्रेस्ट फीडिंग होती है इसमें सेवरल एडवांटेज होते हैं ब्रेस्ट फीडिंग के, जो कि क्या करते हैं मदर्स और बेबीज़ के लिए बहुत ही ज़्यादा हेल्पफुल होते हैं। ठीक है। और ये क्या करते हैं, बेबीज़ को भी इन्फेक्शन से क्या करता है, प्रोटेक्ट करता है। और उस जैसे लेटर लाइफ में डायबिटीज़ है, ओबेसिटी है, अस्थमा है, ऐसे रिस्क को भी क्या करता है ब्रेस्ट फीडिंग रिड्यूस करता है। और WHO ने ये भी कहा कि जो मदर्स होती हैं तो वो ब्रेस्ट फीडिंग क्या करता है, यूट्रस को कॉन्ट्रैक्ट और ब्लीडिंग को कम करने के लिए भी हेल्पफुल होता है। आफ्टर डिलीवरी के बाद क्या होता है, मदर्स में ब्लीडिंग भी होती है और यूट्राइन कॉन्ट्रैक्शन होने के लिए भी क्या करता है, वो हेल्पफुल करता है। ठीक है। और ये भी है कि मोस्टली क्या होता है इसमें, ये क्या करता है, जो मदर्स और बेबी के बीच क्या है, एक ग्रेट बॉन्डिंग भी जनरेट करता है। ठीक है, मदर्स और बेबी के बीच। आई होप आप लोग को ये जो भी मैंने इन्फॉर्मेशन दिया आप लोगों को हेल्पफुल रहा हो, आपको अंडरस्टैंडिंग हुई हो, आपको समझ में आ गया हो। थैंक यू।
Good morning, students. Here we are gathering together for celebrating the breastfeeding week, which is from 1st of the August to the 7th of the August. Okay. So what we have to discuss in this breastfeeding week is that if it is safe to breastfeed the infants while a woman is having corona, that is COVID-19, or a breastfeeding woman which is partially vaccinated or the fully vaccinated, if it is safe or not. So all we are discussing here about these things. So here I am Archana Sahu, a lecturer from the Manoj Jain Memorial College, wishing a healthy breastfeeding week to every lactating woman. Next thing which we are going to discuss is about the breastfeeding during the COVID-19 pandemic. which are mainly the guidelines recommended by the WHO and the UNICEF. What are the different things the WHO and the UNICEF recommend about the breastfeeding in this COVID-19 era or in this pandemic era? So let's we see their recommendations. There are different recommendations they have given. So WHO continues to recommend that standard infant feeding guidelines to be adhered to during COVID-19 pandemic. Some of guidelines includes initiation of the breastfeeding within 1 hour. They focus that the breastfeeding should be initiated after the birth of the baby within 1 hour. After that, we will see what other guidelines they have given. Then the second guidelines which they have given is the exclusive breastfeeding until the babies are of the 6-month-old age. As usual, it is in normal breastfeeding mothers. Then third guideline which they recommend about the breastfeeding is that continue breastfeeding along with nutritionally adequate and the safe complementary foods until the age of the 2 years of the old and beyond, if the baby wants to breastfeed or if the mother is continue lactating until that time. So there is no changes in the breastfeeding administration by a lactating mother to their infants. There is nothing changed. Nothing guidelines have shown any changes in this pandemic area. This shows that the importance of the breastfeeding is how much. Okay, along with all that guidelines, I would like to add something more queries which one may have or you may have or anybody can have. If a person is a lactating woman is having COVID-19 or she is COVID-19 positive, if she can breastfeed, if she is fully vaccinated, she can breastfeed, if she is partially vaccinated, she can breastfeed. Or furthermore questions, if she is a positive COVID-19 patient and having a newborn baby, and along with that she is having medications too, if it is safe to give breastfeeding to their infants. Let's some points to be discussed about all these things. So in this breastfeeding feeding week, I would like to add some my points regarding all these queries and all these questions. So along with all that guidelines which WHO has recommended about the breastfeeding for this week of the breastfeeding celebration, if a woman is fully vaccinated, let's talk about this, then there is no need to take any precautions. Okay, if the woman is fully vaccinated, then she can normally feed her baby as she was do in normal condition. Okay, if COVID-19 vaccines are considered safe for breastfeeding mothers, oftenly this question will come arise in our mind, if COVID-19 vaccine is safe for the mothers or not, especially to the lactating women. So if we see, even in research studies, it has highlighted that those mother whose vaccination are completed, okay, COVID-19 mRNA vaccine antibodies in their breast milk of the lactating mothers provide protection to infants. That antibodies which is formed in their body goes along with the breast milk to the infant, and it provides further protection to the baby, causes no harms to them. Okay, next is if not fully vaccinated, partial vaccination, that is the first dose is given, and after that it is safe to feed your baby or not. So the answer is yes. You can lactating mother can feed their baby when while she was partially vaccinated. First dose has been completed. Now she can breastfeed the baby. No changes has been given to them also. Wear mask, wash your hands, proper sanitization, hygienes, maintain all these criteria, and you can breastfeed the baby. Even skin to skin touches probably necessary for the baby for their growth, development, temperature maintenance, such as in KMC. Okay. Next is, now it's come to COVID-19 positive lactating mother. If a mother is COVID-19 positive, what about them? If they can breastfeed or not? So here the answer is also yes. A woman having COVID-19 positive test can breastfeed the baby properly. Okay, so what are the recommendations they can follow? If a woman, lactating woman especially, is positive and they have to feed their baby, then they should wash their hands, wear mask properly, hold their baby in a skin to skin touch as in normal breastfeeding a woman is doing. Okay, and she can feed her baby directly to her breast by before feeding she can clean the nipples also. Okay, so proper sanitization and hand hygiene, all these things are the necessary before feeding the baby in COVID-19 positive lactating mothers. The next thing is that if she doesn't want to feed directly and the family is not supporting that you can feed the baby directly, then in that condition what she can do? She can express her milk. Expressed breast milk, you all have listened, I think. Expressed breast milk is a milk in which the mother expresses or excrete out her milk from her breast and collect it in a bottle or a bowl. Then after the excretion of this milk, this breast milk which is released or excreted out from the breast is given to the baby by mother or by any healthy caregiver or any family members or anyone who is present there to feed the baby, to care the baby. So if the woman is doing this expressed breast milk process in the case of the COVID-19 positive, then how she is supposed to do this process is cover face mask properly, wash your hands well, then clean your nipples and area around the breast, then bottles, pumps, these all things are properly cleaned, then she can express her breast milk. After the excretion she can store it for an hour, 1 hour only. Then next thing what she can remember is the expression of the breast milk is should be done about 6 to 8 times in a day, 24 hours in the duration of the 24 hours she has to express her breast milk for 6 to 8 hours, so can the baby can feed properly in her in his or her proper feeding time. Okay, and any healthy caregiver can provide this feed to the baby. Okay, along with that, if it comes to the medications, if we are talking about the medication, then even the most of the medications are the safe. It is considered, or in research studies it is shown that the medications during medications which are given during the COVID-19 patient, which are we are giving to the COVID-19 patient and who are especially the lactating mother. So most of these medications are the safe during this lactating period. No any harms are seen to the infants, as a very low amount of the excretion is noted from the mother's milks to the infant. If the excretion rate of the medication from the milk to the baby is very low, then there is very much about 0.1-0.2% chances of this medication to transmit the baby, and baby's body, infant's body can fight this medication and no harm is seen in the infant's body. And such of these medications are such as azithromycin, ivermectin, famotidine below 40 mg of the range in a day, and vitamin D, vitamin C, these all are the safe medications and there is no harm to the baby while breastfeeding. So, in short, we can say in this pandemic era of the COVID-19, there is no restrictions in the breastfeeding, even to the partially vaccinated lactating women, fully vaccinated lactating women, whether it is COVID-19 positive lactating woman, or whether there is any kind of infection which is due to coronavirus. Okay. What we can do, what she can do, especially lactating woman can do, is that only she can take proper care, wear mask, hygiene maintenance. Okay, this is the key things which she should remember and continue with the breastfeeding. Have a healthy breastfeeding week to everyone. Thank you so much.